good morning again. This is Dr. Mark Cooper, and I'm going to talk to you this morning about a self-help pain control strategy, or a strategy that actually helps your ligaments and joints heal and helps reduce inflammation. This is called an ice massage technique. And ice massage techniques is a way that I learned many years ago when I was working for Greenville Hospital Systems Corporation in their chronic pain program. And I've used it pretty much ever since. It works very well as an adjunct to other strategies. So if you've got plantar fasciitis that I've mentioned earlier in a video, or if you've got a tendonitis, or you got a strain, or even if you've got a flare-up of gout or any joint problem, ice massage is a good technique because it reduces swelling and increases circulation.
Okay, I want to just draw you a diagram of what happens when you use both heat and ice on tissues in the body. At first, let's say this is the diameter of the blood vessels, and when you apply ice to that blood vessel or that tissue, like it's the ankle or a wrist or the hip or a back or whatever, when you first apply ice, it's a cold sensation and your body reacts, and it reacts by trying to warm up that area. And so when it warms up the area, the way your body does that, it actually increases and dilates the blood vessels, so you got an increase of blood to that area that you're applying the ice. So you got an increase. Now, after about 3 to 4 minutes, if you're applying straight ice, then you get a decrease again. And the reason you get a decrease again is because it starts affecting your core body temperature, and your body's going to shut off the circulation to that area that you're applying the ice. So when you do an ice massage technique, you're only going to do it for maybe between 1 and 3 minutes. And I'll tell you about that, how you decide. But then you shut it off. Now that's when you're using straight ice. Now you can get by with ice packs that people use, or maybe a towel in between it, and you can leave it on for 10 to 15 minutes at a time. But you still got to be a little bit careful of that. But this technique works real fast. Now, the same thing with heat. So if you're using heat, for example, when you first apply a heating pad or a far infrared heating lamp or anything that I've talked about in the past, again, here's your circulation, and the heat increases your circulation to that blood vessel, to that area. But after a period of time, actually there's a decrease, and actually the circulation decreases. Now, I see people all the time who use heating pads and go to sleep on them. That actually is not healthy at all. You want to make sure that you don't use heat for more than about 20 minutes at a time, because after about 20 minutes you get this effect, and you actually get decrease in circulation, and it actually increases inflammation. However, it kind of fools you because it kind of creates a numbness in the back if you're using it on your back, for example. And so it's real important to put a timer on those things, or have an automatic shut off on them, but you don't want to be using it too long. Now, one of the ways you can tell if you've been using heating too long is that you'll get blotches on your back. Now, I see people all the time who've got back problems, so when you look at their back, if they've got blotchy looking skin, that means they've been using heat for too long a period of time. Now, let's talk about how to do this ice massage, so you got the understanding of what happens physiologically.
What I like to do when I'm doing ice massage, I like to freeze ice ahead of time in a styrofoam cup, a small one like this. All right? And the reason it is because it's real hard to hold ice cubes, and you don't have a good hand hold on it, and your fingers you don't need your hands cold when you're trying to work on another body part. So what I do is I freeze this cup, and then you just cut off a section of it. Actually, this broke the cup a little bit, so it's a little harder to hold. But you break it off, so you got a pretty smooth surface, okay? And you got something to hold it with, styrofoam, all right? I've got a torn ligament in this foot, and also have some injuries to it and history of gout. So I'll put this on top of a board, on top of a waste paper basket, for example, so the water's going to drip into it. And then you take this ice and you just rub it on the area that's painful. You kind of rub it kind of slow, and I just let the water drip off into the
waste per basket. Now this improves the circulation, but it won't take very long. And you want to work of an area about a 2 by 2 to 3 to 4 inch area, but don't try to do a great huge place at one time. If you have multiple places, work on one area and then stop, and then you work on another area and then stop. But this works better than an ice pack, and it's quick. And see, it kind of, the ice will help kind of massage it a little bit. And now you're going to do this until when you do this, you can't feel. In other words, it's sort of numb. And then you quit. And you'll notice it's beginning to get a little bit of redness there. And that's because it's improving circulation. So I'm going to work on this side first, and then I'll work over here. You sort of rub it. Now this is really good to do if you've had an athletic injury. I actually do it the first day when I had gout attacks. It's really hard to get anything to calm it down, but I can do this and it calms it down a little bit, but it improves the circulation. It's kind of numb. So that's about how long it takes. It doesn't take very long. Then I'm going to work, I work on this area here because I got kind of 2 strains going on right here and another one here. So now I'll work on this side. So it's a real quick application and treatment. This is really good to do if you got like a crick in your neck, and you know, if you watch one of the other videos where I did utilization of that acupuncture XL2 device. If you haven't, go back and watch that one because that's really good for myofascial pain and headaches. Works for trigger points. Use this technique after that, but also you can use it on the joint to calm things down. So I hope this is helpful to you in terms of another strategy to help some of the aches and pains that we go through every day in our daily lives. And again, this is Dr. Mark Cooper, and I'll talk to you another time.